Welcome back to our channel. Today, we're diving into a clinical case that exemplifies an important aspect of healthcare: pneumonia. Our focus will be on a 52-year-old man who presents with concerning symptoms and how we can approach such a case systematically. So, let's get started. Our patient is a 52-year-old male who arrives at the medical ward with a 3-day history of fever, a productive cough, right-sided chest pain, and difficulty breathing. These symptoms can be alarming and often indicate an underlying respiratory issue, so prompt evaluation is critical. Upon examination, we find his vital signs revealing a temperature of 38.9 degrees Celsius, a respiratory rate of 32 cycles per minute, a pulse of 110 beats per minute, and blood pressure reading at 160 mmHg. His oxygen saturation is notably low at 88% on room air, highlighting the potential severity of his respiratory condition. A clinical examination of the chest reveals reduced expansion on the right lower zone, a dull percussion note, bronchial breath sounds, and crepitations in the right lower lung field. A combination of signs that raises our suspicion for pneumonia, particularly in the right lower lobe. Based on this clinical picture, the most likely diagnosis is community-acquired pneumonia, specifically right lower lobe pneumonia. This type of pneumonia is acquired outside of a hospital setting and typically results from various infective organisms. Now, let's discuss 4 common organisms that can cause community-acquired pneumonia. 1. Streptococcus pneumonia, a leading bacterial cause of pneumonia, known for its virulence and common presentation. 2. Haemophilus influenzae, often seen in patients with underlying lung conditions or those who smoke. 3. Staphylococcus aureus, particularly notable for causing pneumonia following viral infections, such as influenza. 4. Klebsiella pneumonia, more common in individuals with weakened immune systems and associated with aspiration pneumonia. Understanding these pathogens enables us to tailor our management approach effectively. To confirm our diagnosis and understand the severity of the condition, we would request several key investigations. 1. Chest X-ray, essential for visualizing the extent and location of the pneumonia. 2. Full blood count, FBC, to assess for signs of infection, such as elevated white blood cell counts. 3. Sputum microscopy, culture, and sensitivity. This helps identify the infective organism and guide antibiotic therapy. 4. Blood culture, important for detecting any bacteria in the bloodstream, especially in cases of severe pneumonia. Although pneumonia can often be treated successfully, it can lead to complications that require careful management. 3 common complications include: 1. Pleural effusion, accumulation of fluid in the pleural space, necessitating drainage. 2. Lung abscess, a localized collection of pus that may require surgical intervention. 3. Respiratory failure, can occur if pneumonia leads to significant impairment in gas exchange. Management plan. Management of pneumonia involves a multifaceted approach to ensure the patient's safety and support their recovery. Here is how we would manage this patient. 1. Admit and monitor vital signs. Continuous monitoring is essential given the patient's low oxygen saturation and increased respiratory rate. 2. Oxygen therapy, to address hypoxia and ensure adequate oxygenation. 3. Start IV antibiotics. Broad-spectrum antibiotics, like ceftriaxone combined with azithromycin, are commonly initiated to combat infection effectively. 4. IV fluids. If the patient is dehydrated, IV fluids will be administered to maintain hydration and support circulation. 5. Antipyretics. Medications like paracetamol will be given to manage fever and improve comfort. 6. Chest physiotherapy. This may help mobilize secretions and improve lung function. 7. Treat complications. Any complications arising will be managed according to their specific needs. In conclusion, our case of community-acquired pneumonia underscores the importance of timely diagnosis and comprehensive management. By recognizing symptoms early and understanding potential complications, we can significantly reduce morbidity and improve patient outcomes. If you found this case study helpful, please like and subscribe for more insights into clinical medicine. Remember, your health matters and being informed is the first step towards well-being. Thanks for joining us today, and see you in the next video.